Thank you, Rachel. Hi, everyone. My name is Julie Mooney-Summers. I'm from Sydney Health Ethics at the University of Sydney. Thank you. Press the button in the right direction. I'm part of the ethics of engagement stream in the CRE, and the question that's really driving our work and our thinking is around what are the conditions, the ethics and the modalities of adolescent engaged research in health services and in the delivery of healthcare. And I thought it would be useful to take a step back and think about the kind of the ethical question of why we should engage. And I think that's kind of been covered a little bit, but I think it's worth just saying. And Jen mentioned some of these things. I've been involved in community-based participatory research for several years, and I've seen all of these different logics in the ways that people talk about CBPR. And I think the first one is a very utilitarian approach, which is it will make the research better. So it will create better questions, it will help us ask those questions to the right people, it will make sure that the people we need to talk to will feel able to speak with us or engage with us. Or it will create better interventions for a lot of the same reasons. But there's also a bit of subtle manipulation, I think, I mean manipulation in that way, in that kind of better intervention idea, and the idea that if the communities have been involved in developing it, then they will be more receptive and softer to it because they will already be invested. So I think that's a very utilitarian approach. I think there's the second approach which Jen mentioned, which is that because we should. So the people who are affected by the research or the problem that we're investigating should be part of the problem definition and the solution finding. And I think the third approach is a complexity one, and this comes up very much in the Hinchliffe paper that we've been talking about in the CRE, which is that problems are just too complex to do it in any other way. So we need to make sure that people are engaged in it, partly because we're failing. So we need to think differently about the ways that we approach problems. So I think the second kind of ethical question for us is an issue about who we should be engaged with. And I think that's come up a couple of times in terms of thinking not just about the easy people to engage with, so the worried wow. And I think a lot of what Rachel's just been describing about people for whom their health or their social circumstances are a full-time job, how do we think about how we actually engage with them in meaningful ways? And I think that the Adolescent Health Research Commission is a real, I think it's our big, bold, brave, risky idea, actually. And I'm excited about it because I think it is a really risky idea. I think it's a public experiment on our part. If we can't get this right, then who can? We're working very hard to be thinking about engagement. But I wanted to raise a couple of questions that are coming up for me when we think about how that Adolescent Health Commission will actually work. And I think the first really obvious one is about what structures create and sustain youth engagement. And in some ways that's an easy one. The more difficult question that we don't often talk about is what structures create and sustain researcher engagement. I think that's the kind of stuff that Jen was talking about at the beginning. So those kind of the negative, the complaining, slightly whingy papers from researchers who've discovered that actually engagement is really bloody hard. And that most of the structures that they're engaging with in terms of doing research don't support or sustain that type of engagement. So we need to think about how in a CRE we're going to do that. And I think that that's about us thinking about how we're going to respond to the challenge, and I think it should be a challenge, of an empowered, engaged and organised public. We are working to try and support young people, providing that organisation to them. So that will be a challenge to us, and we need to think about that. And part of that is around the power dynamics. What will emerge and how should they be managed? And how will those things change over time? There are diverse interests at play here. The young people will have different interests, of course, to the researchers, and we need to think about how we're going to resolve those challenges, which will inevitably come up. They should come up, and if they don't, it means we're all being too nice to each other, and we're not going to succeed at it. I think that there's also an issue about how we decide what matters to us together in this joint endeavour. So it's not enough to kind of think about what it is that young people's interests are, because I think that this is about a collaboration, about us working together to resolve issues. And that means we have to come up with a sense of shared meaning and then think about how we sustain those commitments in the face of competing or conflicting demands. For young people in the ebbs and flows of their lives, so Betty mentioned the flexible membership or short-term or long-term, that's a real challenge for researchers. So how are we going to respond to that? And then the conflicting demands in researchers' lives about, as I mentioned, institutions that don't necessarily value as much as they say it sometimes in their strategic documents, that in practice don't necessarily value that type of engagement. And I think there's a final really tricky, gnarly question which I have faced a lot in community-based research, which is about what role the AHRC has in research dissemination. Should they and how should they have a say in how issues are framed? Should they have a veto over the kinds of things that we say and the kinds of ways that we say them? Those are really easy questions for people to have a position on when they're talking about big pharma, but that's a much trickier question, I think, for us to think about when we're talking about communities and young people. So they're the kinds of things that I'm really looking forward to us worrying about and thinking about in this big public experiment.